this is our second live video session. Um, we had some technical issues. The original link did not work for some reason, so this is the new link. We're going to resend it to everybody now. And as usually, we'll talk hair loss in both men and women. This is what I do every single day as a board-certified hair restoration surgeon. It's important to have these talks periodically because there's so much information provided over the internet, and it's not always correct. And the reason why I decided to do this live sessions is actually to help people to get more reliable information from physicians, not from some self-proclaimed hair expert. And there's a lot of good physicians around there, and I'm sure we are all trying to help each other to educate our patients, because when you do something that's not really helpful, first it might not be helpful, and the second thing, it might actually be harmful. So there's a lot of the problem with today's reality world, that we frequently get impression from Instagram, TikTok, other platforms, chats, forums. There's so much stuff you can get your information from, but it's not always from reliable sources. There's a lot of opinions there, and not everyone has the right opinion, right? Okay, so today we wanted to look some of the examples of questions that arise from chats, forums. There are quite a few on Facebook, and every time I open and people ask questions, and there are a lot of other members of this chat or this group, they respond, and sometimes I get a little bit concerned about what the answers could be. And again, I have no control of the forums, I have no control of chats, but what I can do as a physician, a hair transplant surgeon, I can try to educate the public to the best of my knowledge, and hopefully it helps some folks around there. Okay, so let's look some of the questions. So we do a lot of hair restoration procedures. One of the things that really important during hair restoration procedure is how many grafts will actually survive. So there is a what we call a discard to transplant hair ratio. So every time I take a graft from the back of the head, this is, by the way, representation of the donor area with the mannequin head. So first we need to stay within a safe zone. And the safe zone is the area in the occipital part and temporal regions that less likely to undergo thinning or endogenetic changes later in life. Of course, it's all relative, but we talk before we do prepare for the procedure, for the surgery. I take the microscope, something like this. Okay, it allows me to see a microanalysis of the hair in the occipital zone. So with this trichoscopy, I'm able to see some early changes in those areas of the occipital part, like thinning of the hair follicles, and it helps me determine whether this zone is actually safe to be taken. Of course, when we look at the younger people, 25 years old and younger, it's hard to determine whether future hair loss will be affecting those gray zones right here. But someone who is 50 plus, 45 plus, usually we will have more established areas. So when I look with this microscope, 50 times magnification, I'm able to see thinning zones and avoid that during my harvesting. Um, so to address the question, how do we keep grafts safe before reimplanting? Very important. This is actually number one reason why hair transplant fail. And we have a separate video where I go all the causes why we don't get results that we want. So it's important to keep grafts in the constant temperature, right? There are some studies that were conducted, and typically until 4 hours after, if we reimplant grafts within 4 hours after it being taken from the donor area, we can actually keep it at the room temperature. Most of the studies shows that there is very little degradation to the graft quality. As the time progresses, and especially it applied to bigger surgery, like 3,000 grafts, 4,000 grafts, when we try to take as many grafts as possible and try to address as large areas, right? People with more advanced degree of the hair loss. And of course, then it's important to keep grafts in, first, good storage medium. Okay, there are some opinion differences between different doctors, different manufacturers, but we have some options that are proven to help to keep these grafts alive as possible, because you understand what happens. So anytime we take the live tissue from the back of our head, it's a live tissue, right? It has live cells. They have metabolism in each cell. Metabolism still continues, right? But the difference is this live tissue does not get any circulation. Normally we have a circulation that carries the energy sources like oxygen and other ingredients. But when there is no blood flow, everything is accumulating in the cell. So one of the reasons why we think that we need to chill the live tissue a little bit is because it's proven to slow down the metabolism. Metabolism is getting slow, there is less byproducts of metabolism, and hopefully there's less damage to the cell. So this is number one. Number two, it's important to keep graft moist all the time. By the way, we just released this recently TikTok response, or there was Instagram response that one of the clinics from, I believe from Turkey, they were playing this really cheerful music, showing grafts sitting on the dry gauze, okay? And when I saw it, and there was probably like 200 grafts sitting on this dry gauze, 4x4, we call 4x4, we call gauze. And the problem was that these grafts were completely dry. And this is the worst injury you can cause to grafts. This is not actually, statistically, this is number one reason why transplanted grafts will not grow. If any, throughout the entire period of hair restoration, it takes hours, right? At any given point, the grafts were exposed to dryness, there's significant decrease in viability of those grafts. And this is something that important to control. This is one of the reasons I spent every minute with the patient, because I'm inside, I'm not stepping out, in and out, trying to supervise the procedure when others do it, but actually present the entire time the procedure. And I have cameras installed in our microscopes, and you can probably watch some of the videos from our procedures, so I can control what's happening. And I'm with the patient every minute during the surgery, because this is number one reason why we don't want graft to be exposed to any dryness during the procedure. Okay, so I hope it's a really brief explanation how we do keep the viability of the grafts from deteriorating over um, of the procedure time. And I think we can move to the next question. Can we open the screen so we can read some from here, like one of the forums? Okay, so why don't hair grow after transplant? Well, this is a huge topic. Why hair doesn't grow? So there's so many causes of failed transplants. Okay, but and again, we're going to prepare actually the detailed video where I will go, hopefully, address every single cause why we have a failed transplant. And it's important to understand, because when you do your research, who wants to be your hair transplant doctor? Okay, it's not enough just to see before and after, because now with our abilities and all this famous AI imaging, you can produce any images that you want. Okay, what is important is for you to feel good about the place where you go and to trust this place. Okay, because with proliferation of AI imaging, um, uh, you can show anything under the sun, but it's not the reality that we encounter. Okay, so when we do the research, I think one of the reasons why I joined ISHRS, and this is this is a big society. It's called International Society of Hair Restoration Surgeons, and we have different committees there. So this year I joined as a member in the committee, participating committee member, Fight the Fight campaign. And what we are looking is to protect the public from places that do not put you in the center of the care. Okay, it's important when you go somewhere. It's important to make sure that first, the physician who does it has qualifications, and this physician participates as much as possible in your procedure, because this is what will determine your outcome. So, and in a few days or maybe a week, we'll finish this video talking about why hair transplant fail, and I will go in details, different causes, objectively, what can cause a failed hair transplant. So the next question from one of the forums: how long does the hair transplant last? Well, I get this question asked frequently during consultations, and the answer is the transplant hair, when, remember, it's taken from the safe zone, and there are no other causes like autoimmune alopecia. By the way, very important to make sure that whoever does the consultation look for other causes of hair loss other than endogenetic alopecia, because we've seen, even most commonly in women, but we've seen in men, increase of autoimmune alopecias that can be misdiagnosed like a male pattern, and this is absolutely no go for hair restoration. It needs to be first stabilized with the treatment. So this is one of the reasons why hair transplant may fail, in case there is some unknown cause of the hair loss. So and when all these prerequisites are met, right? We got hair from the right area. We made sure there's no autoimmune cause of the hair loss, and the hair start growing in the recipient area. It should last a lifetime. Question is, if you have a partial hair loss, so if you have an empty area like me here, right here, there's no hair at all, right? If I take some of the donor area from the back and I place into this empty area, this hair will grow probably till I'm die. The problem is with the pre-existing hair, and this is where most of the frustration that we experienced, um, not we, but patient experience after the hair transplant, because we need to realize that having hair transplanted into the empty area does not protect this hair that I had before the transplant. So the hair that I had before the transplant will continue to disappear until we do something to protect it. And we have different options. There's a lot of emergent treatments like exosomes. We had more established treatment like Regenera, PRP, topical solutions, minoxidil, finasteride, combination of both, right? Even injectable dutasteride is something that emerging and very promising too. So laser, low-level laser therapy. So we have plenty of options, and some people get better result with a combination of treatments or medications. Some people get other solutions, but again, this is why it's important to establish a relationship with the physician qualified to treat hair loss, so we can track and try different combination or medications, make sure that we get the best results with prevention of the hair loss. So again, probably was a little long. Um, the answer was a little bit too long, but the bottom line here, even after the hair transplant, we need to continue with prevention of hair loss, because the pre-existing hair will continue to disappear. Androgenetic alopecia, female pattern hair loss, cannot be cured. This is a lifelong condition, and just like any chronic condition, requires chronic, repetitive, daily treatment. This is the bottom line. Very important to understand. Very in-depth. So here's a question from Hadi. Very in-depth information. Thanks, Dr. Max. I choose to get the hair transplant. Will this be one-off procedure, or will need the second procedure as well? Yes. So, good question. Hadi, great question. Having one procedure does not negate the need for another procedure. Sometimes you have to need 3 procedures. This is exactly related to the previous statement, because hair loss is ongoing problem. It will continue. Even with the best treatment, we might not be able to control everything. So we always hope I take this medication and it will address all my problems. But sometimes it's not the case. We're all different. Some people get good results with just one medication. Some people do not get as good results with multiple medication, multiple combinations of treatment. So always we need to mentally be ready that we might need another transplant to the area that was not treated previously. Okay, so Alar on the mix, that's the next question. Can wearing hats or beanies affect hair loss? Great question. I've been asked repeatedly for the last years. The answer, it can and sometimes cannot. So it depends on what type of hat, depends how long we wear it, depends how tight it is. So there's a famous group in India, and I think they called, they wear really tight hats the entire life, right? I think we call them, well, right now out of my head, but they have a hat that splits right here in the middle, and it covers the entire surface. It is really tight and it moves frequently. So these tight beanies, tight hats, when they move frequently, they can cause some type of alopecia that we call, yes, and they call friction, correct. but they can cause breakage and pulling on the hair, and as a result, alopecia, which is irreversible, right? So always make sure the hat that you wear, it's not for a very long time, it's not too tight, and loose head does not affect, when it's too tight, it can affect the blood flow as well, can constrict some of the vessels, and we want to provide as much blood flow to scalp area as possible. That what helps with the health of hair follicles. So I hope it answers the question. All right, any more questions? Okay, so go next. How long does the hair transplant surgery day last? Answer is not very straightforward. So it heavily depends how big is the procedure. Smaller procedure with smaller graft count, like 1,000 grafts, should not last very long. 4 or 5 hours. Bigger procedures, 3,000 grafts plus 4,000 grafts, can take up to 12 hours. It's not all these 12 hours we just do procedures, right? We are one of those facilities, and very few right now, that we do include hyperbaric chamber treatment. And maybe by the end of this life, I will take a quick tour clinic just to show and explain what the different areas, how we design. We just opened our new location in July of this year. We're still working on improvement, but I will explain some of the areas. So hyperbaric oxygen therapy, I like to include on the same day of the procedure because it brings what these grafts need, oxygen. And oxygen is very powerful, especially when we can provide up to 5 times of the normal levels with hyperbaric therapy. Because grafts are starving for oxygen. They've been taken out, they've been sitting in a petri dish in a moist environment for some time. So this idea is to bring this oxygen. Also, oxygen has anti-inflammatory properties. It helps to reduce post-procedural swelling, and so on. Okay, it helps to increase regenerative processes, stem cell proliferation, and so on. So I like to include it as part of the surgery. So it takes 3 hours. Typically, when I harvest, let's say our average case is 3,000 grafts. We working on usually big procedures. So 3,000 grafts harvesting will take me approximately 3 hours. 3,000 graft harvesting will take me about 3 hours to reimplant. So the actual procedure will last about 6 hours. And everything else, we have a lunch in between, have this hyperbaric treatment, some downtime. So that's what I accumulate. So, but the actual procedure is 6 hours, even for those big surgeries. What is the biggest hair transplant myth? This is a very, okay, so, okay. All right, so we have some kind of nonsense questions, so I'm going to ignore them. But here's another one. Okay, can shampoos and hair care products make hair loss worse or cause hair loss? Some hair products are known to cause hair loss, right? Depends how you use them. Okay, so one of the products being associated, especially used with strengthening hair, they can be toxic to the skin. There's it's a big topic, so I'm not going to list most of the products, but we can actually research that. So I prefer to advise my patients to use as little as possible chemical applied to their scalp, especially something that can burn the skin, right? So some of the treatments with hot combs can actually cause burns and result in scar and alopecia. So it's safest to use mild shampoos, conditioners, and as little manipulation as possible. So one of the famous thing is this keratin treatments, right? Or they call the hair botox, right? It's very harmful to the health of the hair shaft, and occasionally can cause some injuries to the scalp area as well. Okay. Okay. Thank you. Yeah, thank you very much, Count Cookie. You're not a real doctor. Well, I can disagree with that. Okay, I think in the United States we have a process of being a licensed doctor, so anyone can look up my name and check whether I have a license or not. Okay, so Count Dookie, you're welcome just to Google and Google my name, and you will, you'll see what license what states I'm licensed in, and yep, that's pretty much it. Okay, so is PRP helpful treatment to maintain hair health after transplant, and now and how often? So PRP is very helpful, and PRP is a vast topic that cannot be covered during this live video. So PRP works by extracting platelets from the blood, spinning them, so we can achieve 5, sometimes 6, sometimes 10, up to 20 times concentration of the plasma. Platelets are responsible in our organism for reparative processes. So let's say if I get injured, cut myself with, I got an abrasion. The way body reacts, it concentrates through chemotaxis. Chemotaxis, that's the exact definition. What happens is it attracts these places to the site of the injury. They start to release growth factors. It's a pretty complex process, but this is what usually happens. And through the chain of events, it starts to, the tissue starts to heal over time. And this is exactly what happens when we use platelets to stimulate different parts of our body to induce a regenerative process. So when I take PRP concentrated solution, we can inject it into the scalp area. We can inject it into the face. We can inject it into the hands, and it helps to rejuvenate the skin, stimulate collagen processes. It can help with stem cell proliferation in hair follicles, as long as we can target it precisely. And here's the biggest problem with most of the PRP is that we can obtain the right concentration, but as long as we don't have a right tool to deliver this PRP to the right areas, it might not be helpful. So do your research, make sure that provider who is going to treat you with PRP knows how to do it. They use right tools. You can check our channel. I have a few videos showing how we approach PRP treatment, and hopefully it will help with making your decision. Are on the mix. Next question. Where are the hair follicles normally grabbed from for the transplants? So, well, we don't grab hair follicles. We do the FUE procedure, follicular unit excision procedure. And so these grafts are being excised one by one. We use small punches. It could be done robotically. And one of the devices that probably #1 in the world right now, it's Artas robotic device that I use to harvest hair follicles from the donor area. And I think I explained a little bit what donor area is. Additionally, we can use body hair, we can use facial hair. Sometimes with multiple procedures and extensive hair loss, we don't have enough in the donor area. So #2, priority after we exhausted the donor here, and I see patients who had multiple procedures starting from early 90s, and they still need more hair follicles because of the same reason I explained, progressive nature of the hair loss. We can obtain grafts from the beard area. We can obtain it from the chest as well. But these cases, again, they're rare and sort of the last resort that we use. Okay, so Ian Murphy. My mother has experienced some thinning. How determine if the female hair loss is caused by DHT, and what the best treatment options for postmenopausal women? Okay, so female hair loss is a separate topic. It is more complex, like within, women are very special. They're complex, and the hair loss, we need to be prepared how to address it, right? So typically, when we talk about female pattern hair loss, especially postmenopausally, one of the reasons is changing the hormones. Estrogen is one of the hormones that is known to sustain the anagen phase of the hair follicles. So once we have changes postmenopausally and estrogen starts to decline, that could be a reason for thinning of the areas, and that's what is defined as a female pattern hair loss. There are other causes. Again, it's a little bit too complex to address in just this quick live view, but it could be treated with minoxidil, could be treated with other ingredients such as other medications such as finasteride. So especially with postmenopausal women, it is off-label, but finasteride definitely can be used to treat some of the thinning of the scalp. Other options include blood pressure medications such as I'm sorry, blacking again. I think it's spironolactone. Sorry, this is exactly what I was looking. So spironolactone is anti-androgenic medication. It helps to lower androgen levels, and this is one of the options we can use. Once we establish that it is indeed female pattern hair loss, we can definitely consider hair transplant is one of the options for treatment, but it needs to be determined by a qualified physician. Okay, so the Stork 2. How often per year do PRP for hair maintenance after the transplant? So I think every physician will have his or her own preferences. I prefer to do it either 3, 6, 9 months, so it's easy to remember for patient. Most of the time we skip up to 6 months. At that time we do the evaluation. Every procedure that we perform, we provide this PRP treatment complementary. And this is an opportunity to check the progress, take the microanalysis of transplanted areas, make sure that non-transplanted areas are being treated, and the results are as expected. So yeah, twice. We also do PRP treatments, perform PRP treatments on the same day of the procedure. So total 3 PRP treatments perioperatively, postoperatively. What makes a hairline procedure bad? So I guess I assume the question is the hairline design, what makes it bad. Okay, so Here's an example of bad hairline design. And why? Because people who created this mannequin head had no idea how hairline should look like. So it's a big topic and was a topic of one of my presentations during ISHRS meeting. And hairline design is very important to ensure the naturality of the end result after the transplant. So to address it, there are different methods how to make sure it is natural. So one of the first thing, our hairline should not be too low, okay? And by the consensus, the hairline should be at least 7 to 10 centimeter above the mid-glabella line, okay? And with more advanced age, to make sure it's natural, we can go even more than 10 centimeter above the mid-glabella line, okay? When we're looking at male pattern hair loss, and you can see I have a little bit more advanced hair loss, but this is what is here is defined as frontotemporal angle. This is the spot where the temporal part connects with the frontal part. And these frontotemporal angles, they have to be in the same plane with lateral canthus of the eye. So this is the lateral canthus of the eye. So if I draw imaginary line, it has to connect there, right? Of course, there are some things that we can design with different people, like little widow's peak right in the middle. But the most important thing to make sure the hairline is natural are the actual irregularities. And I think we're going to be working on another video talking about hairline design, what are the points that we need to address, such as micro and macro irregularities, to make sure that when you walk around with the hair transplant done, it's not obvious to anybody. Okay, so any questions from here? Okay, so I will read next from. So the next question we obtained from Hair Loss Conquerors Forum, who usually performs the hair transplant? And it's very important question. I think this is the first question you should ask when you go for consultation, and you ask who performs the hair transplant. And this should be a determining should be information that help determine whether you want to do a transplant or not. It is important for physician to take as much participation as possible in the hair transplant. And I give you a couple case scenarios. So when you are, as a physician, relying on hair transplant technicians to do most important parts of the procedure, you have no control what's happening. You can have 2, 3, sometimes 4 different people with different degrees of professionalism, right? And as you know, in any organization, you can have superstars, and you can have anybody in between, okay? So it's not always possible to have a superstar as all 4 of your or 5 people who participate in the surgery. And when you rely on them to do most of your procedure, that's not always a result in the predictable results. Or another case scenario, for example, you have 2 superstar technicians who do the implantation, and then one of them is calling in sick on the day when you have a surgery scheduled. So what are you gonna do then? Okay, you cannot just train someone within a few hours. It takes sometimes years to train one person. And this is the real case scenario. People can they have kids. People can call in sick at any moment, right? And you're not gonna cancel a procedure. So this is all this all questions that should arise when you don't, as a physician, you don't take part in the procedure. That was the reason why I changed it since 2018. I don't use technicians to either harvest or implant hair follicles, and I do the entire procedure by myself. So, well, not by myself. I have assistants who help me with other tasks, like counting grafts, like assisting me with during excision. But the most critical parts I do with my own hands, and I will continue to do it. And this is one of the reasons why we created a center, patient-centered model, because I think we need to be transparent, we need to be honest with our patient, and they know when they come to us, there's nobody else who does anything surgical except of me. Okay, so next question. So the question was, Yasugo, do you use technicians to do the surgery at your clinic? So that's exactly what I answered. So we use technicians as my assistants, but I do every part of the procedure by myself, and I trying to encourage other doctors to do the same, because I think this is the basic trust that we need to project to our patients. And this is what makes you different from the rest. Okay. So a friend of mine had a hair transplant 2 weeks ago. 12 days after he went to surgeon to remove the scabs, he told me that the surgeon was very rough in removing them from the scalp. Is this normal? So my approach to post-operative scabs, I don't touch them at all, okay? Why I don't touch them? Because sometimes if you're too rough trying to pull them, you can actually remove the entire graft, the entire hair follicle or follicular unit, and obviously once it's out, it's not gonna grow. So my approach is to let it be. Usually it takes 2 weeks for these scabs to disappear. If it takes longer, let it be too. Okay, it's important to not to disturb these grafts by any means. So this is my view. You might have different doctors with different opinion, but this is why we're all different. But I prefer not to touch these scabs and risk the rest of the grafts. So next question is from Jan Murphy. I've heard about transplant clinics doing procedures large as 8,000 grafts in single procedure. Are they lying about their graft counts? Is the risk of doing procedure that large? Well, I think they're either lying about the graft count or they simply expose patients to unnecessary risks. Let's us understand what's the average graft count we can obtain from the average person. And the answer is between 6 to 7 grafts, but not in one procedure throughout lifetime. And this has been calculated as in any hair restoration textbook. You basically calculate how many square centimeters are available in the donor area, and different people will have different size of heads, and consequently will have different count of the square centimeters. There are other factors such as density, vascularity, previous procedures, scars, and so on. Anytime you have a procedure, have a scar tissue proliferation because of the procedure, then you have less blood supply. So when you say someone did 8,000 grafts in the patient, again, they either lied or they just risk this patient unnecessarily. And I think someone who takes 8,000 grafts should not be practicing medicine and should stay away from doing any procedures because it's not safe, it's not good for patients. I think the most you can take safely would be somewhere in 4,000, maybe some patients. Again, this all about the donor area, okay? The more donor area, the more grafts you can obtain. But if you take them too close together, you can damage those vessels. Then you can see really bad outcomes such as necrosis of the donor area. And if you Google what is necrosis of the hair transplant donor area, you can see what could happen. So it's important to do it always safe. Okay, we got 10 more minutes to go. Okay, Evgeny, hi there. Okay, can a diffused hair thinning get a hair transplant? So good questions. So diffused hair thinning probably should not get a hair transplant. And we call it a DUPA, okay? It stands DUPA, it's a diffuse unpatterned alopecia. And it is a contraindication for hair transplant. It's considered to be atypical type of hair loss or unpatterned hair loss. And we do treat patterned hair loss. That's why we call it female pattern, male pattern hair loss. And these two conditions are amendable to treatment with hair transplant. Everything else, again, case-by-case basis, we can, but DUPA should not be treated, or diffuse unpatterned alopecia should not be treated with hair transplant. Okay, any more questions? I think we have less than 10 minutes to go. I will read then from the prepared questions. Do hair oils like rosemary oil work? Well, the answer is simple. Okay, there's a lot of products that have been advertised as helpful for hair loss, and there's no clinical proof. And until, as a physician, I need to look evidence-based. So unless treatment has an evidence behind it that it works, I will accept that. I don't think rosemary oil has any studies being done or any objective data showing that it actually helps. So probably not. Don't waste your time. Okay, so next question. What are the best medications to prevent hair loss? So there are two well-known medications, and they are being studied for many years. One is finasteride and minoxidil. There are other emergent treatments, and one of the changes that we started seeing in our approach to treatment, that we started to use more topical solutions. And this is one of the examples of medication that I use myself, and I've been using it for 7 years. And this is something that we offer to our patient, is the topical finasteride minoxidil. There's other ingredients such as melatonin. So melatonin, if you go to a website called PubMed and you search melatonin hair loss, you can see there are a couple studies showing that topical melatonin might be also helpful, right? So we did include it here, okay? There's also biotin here, and biotin, probably well-known vitamin. By the way, what works, what doesn't work. So vitamins, and we talk about different brands, and they claim this vitamin will help you to regrow your hair, and they contain different type of zinc, vitamin A, vitamin C, and so on. So vitamins only work when you're deficient. If you're deficient in biotin and you use biotin, that it will help you. But if you're not, so uh, all supplements, yes, I don't think there's a harm, but there's no evidence it's going to help. So, do I need a medication after hair transplant? Yes, if you do have pattern type of alopecia, you do need to be on, well, you don't have to be, but as long as hair is important to you, you can continue with preventative therapy and medications such as finasteride, minoxidil. We can add others, topical melatonin, and so on. But yes, I think it's important. Okay, another question from Ian Murphy. Will low-level laser therapy caps help to grow new hair, or does it only help thicken existing hair? So very important, and it's a very good question. Okay, with all the proliferation of different ads and companies who are trying to promote their products and say, and in their advertisement, take this product, it's gonna grow new hair, you're gonna see more hair growing. This is completely false. It is false and it will remain false. You cannot grow new hair. Once, if you refer to dead hair follicle, that means this hair follicle doesn't exist. There is nothing there. Once there is no hair follicle, it will not grow no matter what you put there. No matter what type of product, low laser therapy, or anything topical or by mouth. So even when we do the hair transplant, we don't grow new hair follicles. We move them from one area to another. So when we use preventative therapy with proper selection of medications, therapies such as PRP, again, exosomes, emergent treatment, that is very promising. We can see a thickening of the fine hair. And this is how we can see improvement with our appearance. When we use it, we have less miniaturization of hair follicles, and miniaturized hair follicle can become thicker, and that's how improvement happens. Doc, can zinc improve the quality of the hair? So again, this is the question about vitamins. Zinc by itself can help with healing, can help with other, as long as you're deficient. Okay, if you take extra zinc, there's no proof it's gonna do anything. So our body is really smart. Anything that it needs, it will take. Everything it's already have enough, it will excrete. So taken, hopefully, okay. Some heavy metals cannot be excreted, so this is the exemption, right? So you don't want to take too much iron because you don't want to take too much heavy metals, right? It's not going to be excreted. So, but I think zinc, if you're deficient, it definitely can help. Okay, Ted Tech, what you think PRP every year? I think it's great. So how many more minutes do we have?
2.
4 minutes. Okay. So PRP per year is great. Okay. So you as long as you had some more intensive therapy. So the way we address it in our clinic is I use 3 treatments, 3 PRPs back to back, so every 30 days. Sometimes 4, depends on the degree of the thinning areas. And then once a year, we sort of use it as a little way to stimulate hair follicles more. And it's a good way to follow up because during this yearly PRP, I will perform a microanalysis. I will save these images and I will compare to the previous year. And we can see whether any adjustment to the treatment plan should be performed, right? And if there is a change in thinning areas, I might need to change the therapy, prescribe different medication change the frequency of taking medication and so on. So once a year, at least, it's important to follow with your doctor so you can see the progress of the treatment and adjust the treatment as necessary. So we got 1 minute, right, to go. All right. So let me just show you really quick. I'm going to switch the camera, okay? And we have a more video. So this is our consultation room. And it looks like this. Some diplomas on the side. By the way, people who ask about whether I'm a doctor, here's the diploma. You can see Doctor of Medicine. Okay. I know there are a lot of people just want to have fun and ask not very intelligent questions, but that's cool. So this is our surgical suite number 1. And here we do less invasive procedures such as PRP. This is the device we use to inject it precisely. Okay. Usually patients are pretty comfortable, and we do FUE procedures. This is the microscopes that I use to observe grafts during preparation. So the camera right here projects the image to that screen. So at any given moment, I can take a look, make sure the grafts are being treated correctly. Here's our hyperbaric center, and we use hospital-grade chamber. We're able to reach 3 atmosphere of pressure. This is the changing area right here. Hair design room. So this is a room specifically to design the hairline. I like it because I can stand behind the patient right here. Here's the patient chair. I can take a look and see the hairline from different angles. We have a special lighting right there to make sure our patients, they are completely satisfied with the design before we actually proceed. So this is our hairline design room. This is the area where we take patient pictures before and after the procedure. So it's right there, everything mounted. This is the hair cleansing. So look at this. This is where we prepare a hairline before the restoration. We clean it, or in PRP procedures, exosome and so on. We clean with warm water, chlorhexidine, to make sure it's completely clean, bacteria-free, and ready to go. Here's our surgical suite number 2. This is number 6, and this is where we do most of the procedures. We use ARTES robot. I see it right here, controlling every movement of the robot. We actually have a surgical table, the real one, because it's very easy to get it in any position, right? We monitor our patients' vital signs. And here, this is the TV that after the first phase, patient can watch during the implantation phase. So both operating rooms are made of Korean stone. I hope I pronounce it correctly. But basically the structure here, it's a special surface that naturally antimicrobial. So including our floors, but every surface here is antimicrobial by definition, because we want to make sure that there's no infection happens. By the way, during surgery, we wear sterile gloves, sterile gowns, so we treat it like a real surgery, and I think everyone should be. Same set of Mantis microscopes connected to the monitor, again, and with the camera. so I can observe and control everything what happens during the procedure. Our sterile processing room. We have some autoclaves here, and here's where we prepare the PRP. So our PRP centrifuge right here. This is the device that we measure every PRP. We measure concentration of platelets to make sure it's the right concentration. And this is 8-hour procedure room. And in this procedure room, we do minor treatments, SMP, scalp micropigmentation. It's well equipped with the lighting and pretty comfortable. And here have our work area. So I hope that was a quick tour of our facility. Let me switch back. Dr. Max, again here. With any questions, please comment and subscribe. We're planning to continue with live streams with prepared videos. I hope it was informative, and cheers to everybody. Thanks for watching. Okay.
That's it. No, don't press anything else.